We will discuss essential medications to take during travel for headaches and body pain. The most important medications are Ibuprofen or Acetaminophen. Long flights commonly cause headaches due to dehydration and changes in cabin pressure. Ibuprofen easily relieves this. Additionally, sitting for extended periods can cause muscle stiffness and pain. Ibuprofen is the best solution in this case as well. You should take ibuprofen with a meal or snack to avoid stomach upset, which is common while flying. It is recommended to avoid ibuprofen if a person has a gastric ulcer or known kidney problems. In such cases, a safer alternative is acetaminophen, also known as paracetamol. It is safe for all age groups, including children and the elderly. Acetaminophen is safer but also weaker compared to ibuprofen, as it has less anti-inflammatory action. You should also remember not to exceed the recommended dosage of acetaminophen. Typically, it is 500 to 1000 milligrams every 4 to 6 hours, not exceeding 4 grams per day. Taking too much acetaminophen or consecutive days can cause liver damage. For allergies and motion sickness, antihistamines are needed. If someone has only an allergy, such as a runny nose, sneezing, or a mild food allergy, then Cetirizine, Loratadine, and Desloratadine are commonly used. If someone experiences motion sickness and also needs sedation, for example, to help with sleep during a flight, then the best antihistamines are Diphenhydramine and Dimenhydrinate, also known as Dramamine. These should be taken 30 minutes before traveling to prevent motion sickness. Diphenhydramine is highly sedating, so it can help with sleep during travel. Dimenhydrinate also has a sedative effect, but is more effective for treating motion sickness, dizziness, nausea, and vomiting. These medications are not recommended for elderly travelers as they can cause confusion or drowsiness. Also avoid using them in children under 2 years unless directed by a doctor. Generally, they are considered safe, but avoid taking them if you need to drive as they can impair reaction time and concentration. For Diphenhydramine, the typical dosage is 25 milligrams 2 to 3 times per day. For Dimenhydrinate, the standard dosage is 50 milligrams. For indigestion and heartburn, Omeprazole is one of the best options. Take 20 milligrams once a day in the morning before breakfast. It helps relieve symptoms like acid reflux and heartburn and is useful for those with stomach ulcers. Omeprazole is particularly good for travelers with chronic acid reflux or those who experience heartburn multiple times a week. However, it does not work immediately. It takes 1 to 2 days to have a noticeable effect. Avoid taking it for more than 4 weeks unless prescribed by a doctor. Other alternatives like Lansoprazole and Pantoprazole have similar effects. Lansoprazole acts faster with relief in 1 to 2 hours, while Pantoprazole is safer for those taking multiple medications as it has fewer drug interactions. For immediate relief of acid reflux, antacids such as Maalox and Mylanta are used. They act quickly but are only for short-term use, as overuse can cause constipation. For diarrhea and gastrointestinal upset, anti-diarrhea medications are often used. While traveling, people frequently eat unfamiliar food, which can cause sudden episodes of diarrhea, known as traveler's diarrhea. In cases like irritable bowel syndrome, when diarrhea occurs, Loperamide Imodium is recommended. It slows down gut movement, binds to opioid receptors, and reduces the movement of food in the gut. The initial dosage is 4 milligrams taken after the first loose stool. A maintenance dose can be 2 milligrams or 1 tablet after each subsequent loose stool. Maximum dosage is 8 tablets per day. However, if diarrhea is caused by a bacterial infection such as Salmonella, Shigella, or Escherichia coli, it is not recommended as it can worsen the infection. If you have bloody stool or a high fever, Loperamide should be avoided as it can mask more serious conditions like dysentery. For mild diarrhea or food poisoning, Bismuth Subsalicylate is also effective. It can relieve mild heartburn and indigestion as well. Bismuth Subsalicylate works by coating the stomach and intestines, creating a protective layer and providing mild antibacterial effects. It helps to reduce intestinal irritation. For diarrhea or stomach upset, the recommended dosage is 524 milligrams or 2 tablespoons or 30 milliliters of liquid. This can be taken every 60 minutes as needed, with a maximum of 8 doses per day. Avoid bismuth if you are taking blood thinner medications or if it is for children recovering from viral infections, as it increases the risk of Reye syndrome. One common side effect is blackening of the tongue and stools, which is harmless but may be alarming if unexpected. For minor cuts and scrapes, antibacterial ointments like Neosporin or Cetirizine are effective. They help prevent bacterial infection spreading. For skin rashes, skin irritation, or bug bites, hydrocortisone cream is effective. It is useful for cases of skin redness. In the case of a severe allergy, when an anaphylactic shock develops, the life-saving medication is epinephrine injections. When a person experiences difficulty breathing, swelling, hives, or low blood pressure after exposure to allergens like food, insect bites, or medications, it is called anaphylaxis. Epinephrine works quickly to reverse blood constriction and open the airways. Without treatment, anaphylaxis can escalate rapidly and become fatal. Carrying an EpiPen is crucial for anyone with a known severe allergy. An EpiPen epinephrine auto-injector should be administered immediately when signs of anaphylaxis appear, such as difficulty breathing, swelling of the throat and tongue hives, rapid drop in blood pressure, dizziness or fainting. The EpiPen should be injected into the outer thigh muscle and can be administered through clothing if necessary. After using the EpiPen, an antihistamine like Diphenhydramine or Cetirizine can help reduce lingering symptoms like itching, swelling, or hives, but antihistamines do not replace the effects of epinephrine. In the case of a heart attack, aspirin helps prevent further clot formation. Chewing aspirin 4 from purfewing aspirin 5 mg during a heart attack can be life-saving. However, enteric-coated aspirin should not be chewed, only pure aspirin. Ibuprofen does not replace the effectiveness of aspirin. For people with a history of angina or heart problems, nitroglycerin helps to relax blood vessels and improve blood flow to the heart. If chest pain is not relieved by nitroglycerin, it may indicate an ongoing myocardial infarction. Nitroglycerin is typically given as a 0.3 mg to 0.6 mg tablet or spray placed under the tongue every 5 minutes for up to 3 doses. When a person experiences excessive fear, worry, or flight anxiety, medications like benzodiazepines such as lorazepam or diazepam can be prescribed for short-term use to manage panic attack. These medications should only be used when prescribed by a doctor and can be taken before the flight to ease severe anxiety or fear. Sedatives like diphenhydramine or meclizine can also help with sedation and aid sleep during long flights. Though they are less potent than benzodiazepines, they are still effective. For anxiety and fears, doxylamine can also be used to aid sleep, and it is highly effective for short-term use. Supplements like valerian root and passion flower have mild, calming effects. These natural remedies have been used for centuries for anxiety and sleep. L-theanine found in green tea promotes relaxation without causing sedation. For people with venous insufficiency or a risk of venous thrombosis during long flights, compression stockings are recommended. It is also important to move around frequently and perform leg exercises during flights. In high-risk cases, aspirin or anticoagulants may be prescribed. For air discomfort or a feeling of fullness during takeoff and landing due to changes in cabin pressure, chewing gum, yawning, swallowing, or using a decongestant like pseudoephedrine spray can be effective. In cases of constipation, the most important thing is proper hydration. Laxatives such as Imodium are safe for long-term use. They should be taken once or twice a day with plenty of water. Stronger laxatives include osmotic laxatives like polyethylene glycol, which soften the stool and stimulate bowel movements. These are less likely to cause dependency compared to stimulant laxatives and are considered safe for occasional use during travel. Stronger laxatives like bisacodyl and senna or Senocot are stimulants. Stimulant laxatives are fast-acting and ideal for short-term relief of constipation. They stimulate the intestinal muscles to increase bowel movements, which is helpful for travelers needing quick relief, such as before a long flight. These laxatives typically work within 6 to 12 hours, so they can be taken before bed to induce a bowel movement by morning. However, stimulant laxatives should only be used for 1 to 2 days and not relied on regularly, as they can cause dependency or worsen constipation if overused. During a common cold teas with a combination of antihistamines, decongestants, and paracetamol with vitamin C like Coldrex or Theraflu are good options. For bacterial pneumonia, especially when it is community acquired, the first-line antibiotic is often amoxicillin or azithromycin. However, antibiotics should not be overused unless there are clear signs of bacterial pneumonia, such as high fever lasting several days, weakness, difficulty breathing, and a cough with phlegm.